Parkinson's was discovered by James Parkinson in 1817. In 1850, French neurologist Jean-Martin Chirat provided more reference to the disease and names it in Parkinson's disease after James Parkinson. In the early 1900s, the pathology of Parkinson's disease is documented, specifically the abnormalities in the substantia nigra. In 1950, Swedish and Viennese neuroscientists discovered that Parkinson's disease is linked with a decrease in dopamine in the striatum of the brain. In the early 2000s, more attention was drawn to Parkinson's disease. New foundations, such as the Michael J. Fox Foundation, were set up in order to accomplish the goal of curing this disease. The most common symptoms of Parkinson's disease are tremor, rigidity, akinesia, bradykinesia, and postural. Resting tremor is present in 75% of all the patients affected with Parkinson's disease. It can affect the legs, chin, or jaw, and creates the appearance as if someone is rolling a pin or chewing gum because of the constant movement of fingers or jaw. Rigidity is a symptom that is an increase in muscle tone that results in resistance to. Akinesia and bradykinesia are the absence and slowness of movement present in people with Parkinson's disease. Over time, these two symptoms gradually increase, and side effects such as smaller handwriting, difficulty standing up, or even getting out of the car increase. Postural change results in a progressive loss of postural reflexes. Someone affected with Parkinson's disease tends to walk in a stooped fashion with their head down and elbows semi-flexed. Parkinson's disease belongs to a group of conditions called motor system disorders, which are the result of a loss of dopamine-producing brain cells. Parkinson's is a neurodegenerative disease, meaning that there is a progressive loss of the structure or function of neurons, including death of the neurons. For a majority of people affected with Parkinson's disease, the cause is still unclear. However, there are possible factors that could lead to Parkinson's disease, such as the genetic causes and environmental. There is no cure for Parkinson's disease, but there are drugs and other therapies that can be used to help reduce some of the symptoms, such as levodopa, dopamine agonists, and surgical treatments. Parkinson's itself is not a fatal disease, but in fact a progressive disease. Often people with Parkinson's disease become severely incapacitated and unable to move or care for themselves within 10 to 20 years of being diagnosed. Although Parkinson's is not fatal, certain symptoms may eventually lead to death.
You hope not. It has affected your movement, it has affected your speech, it has affected your facial expression,